Hi, my name is Dr. Raymond Cho, and I'm the owner and medical director of Houston Mind and Brain, and I'm also a professor of psychiatry at Baylor College of Medicine. And today I'd like to tell you a little bit about our research program here in Houston Mind and Brain, and probably best to start by just motivating why we want to do research. So in psychiatry, we have a lot of good treatments, and we've certainly advanced very significantly over the last few decades, but that doesn't mean that we're done yet. There's still a lot of unmet needs for new and better treatments across various disorders. And to try to help meet this unmet need, we would like to conduct research to help that effort in exploring novel drugs and in some cases even digital therapeutics. So what kind of research do we conduct at Houston Mind and Brain? Well, the approaches and the diagnoses that we address are quite varied, ranging from digital therapeutics, for instance, phone apps to address negative symptoms in schizophrenia, or medication trials, and that can be administered orally through oral meds or intranasal sprays for other studies. And the diagnoses that we've sought to investigate and aid in the development of novel treatments vary greatly, ranging from social anxiety disorder to depression to bipolar and schizophrenia. So you may have heard the terms phase 1, 2, 3, and 4 as applied to the different phases of clinical research. Phase 1 is really geared at establishing basic safety information. Phase 2 is targeting both safety and dosing. And then phase 3 finally is to more firmly establish safety but also efficacy of the medication. And then finally, phase 4 is post-marketing data acquisition after the drug has actually been released to market. Here at Houston Mind and Brain, we conduct primarily phase 2 and 3 investigations. This is so that we're both reassured and that we can reassure patients that basic safety data has already been acquired, and we're then contributing towards further establishing safety of the therapeutic, but importantly also contributing to our knowledge about efficacy of the novel therapeutic. So why might patients want to participate in clinical research? Well, first and foremost, many patients are primarily motivated by altruistic reasons. They really want to help others by participating in contributing to novel therapeutic development, and this could be in the form of medications or novel devices. Patients may themselves also benefit by having access to novel therapeutics before they even reach market, and this may be particularly of interest to those who feel like they've exhausted other more standardly available clinical options. Also, as a more general point, patients who participate in research often feel that they're getting better and more regular clinical attention just by the very regular visits through the study that involve clinical assessments, lab tests, and various other types of assessments that are typical of these research studies. And then finally, of course, we always value patients' time and effort, and so all subjects are always compensated for their valuable time and effort that they contribute to the study.